So this morning, we'll be chatting with Dr. Harry Smith. He's the Principal Medical Officer of the National Surveillance Unit. And there are only a few suspected cases of hand, foot and mouth disease in Trinidad and Tobago, according to the Ministry of Health. However, former Health Minister Dr. Fuad Khan is warning that the virus could have mutated from the last outbreak back in 2011. Joining us on set, as I mentioned to you earlier, to tell us more about the virus is Dr. Harry Smith. Welcome.
Thank you.
What is the hand, foot and mouth disease and what are the symptoms?
Okay, hand, foot and mouth disease is a self-limiting condition where you get fever, painful sores in the mouth, and also rash blisters on the hands, feet, and buttocks.
All right, and is it life-threatening?
No, it is it's a very mild form of disease. No, the truth is, if anybody has to be concerned about something, it is influenza. I mean, hand, foot and mouth disease, because it's lots of children get it. I mean, you said that there was an outbreak in 2011. There was one in 2015. It comes and goes, but it normally does not cause anything major. Now, let me go back and say that influenza is more serious. It can lead to more fatalities. Hand, foot and mouth does not really cause fatalities at all.
So what causes hand, foot and mouth disease?
It's a particular virus that circulates in the population. It's common in infants. Normally when you get it as an infant, you don't get it back as an adult. You can get it back because of, as you pointed out, it can mutate, but generally it's very self-limiting. It's a particular type of virus.
So what makes us susceptible to this particular virus?
Well, we exposed to viruses throughout our lifetime, and as a person grows, they encounter new viruses. So that's why children normally get it, because as a child you would not have been exposed. As adults, you probably got it already as a child, and you get it, and so you get it as a child, and little blisters here and there, and you get over it like nothing.
So if you get it once, you're not going to get it again?
You can get it again, a mutated strain, but again, you'll probably be able to recover a lot sooner. Because you already had antibodies to the original one.
Right. And how many confirmed cases are you aware of in Trinidad and Tobago at this time?
At present, there are no confirmed cases.
No confirmed cases?
No confirmed cases, just suspected cases.
Suspected cases. And how do you confirm it? Is that you do blood tests?
Right. You take a swab of the area of the blister and you send it off to the lab for virology testing.
So people would have come forward to get tested and the results were negative?
Right, so we'll be waiting the results.
Oh, okay. Well, so far we don't have any confirmed cases.
Right, just suspected cases. But again, I don't want to emphasize that
I understand.
We would like to focus, actually, the Ministry of Health on something a lot more serious that can lead to death, which will be influenza.
Okay, so let's switch to influenza. How many confirmed cases of influenza do we have in Trinidad and Tobago at this time? At
present, there haven't been any confirmed. Again, it's about doing testing, and normally what happens at our hospitals or health centers would be that you come in sick, the doctors will treat you appropriately, whether it's with pain relieving medicines, medicines for your fever, or they just treat you symptomatically, help you with your cough and your cold. And so you don't always have the testing that is sent to the lab for confirmatory things. So you only have a lot of suspected cases. Off the top of my head, I don't have the figures in front of me, but you asked about confirmed cases, and so right now there will be, for influenza, no confirmed cases, but we administer the vaccine. This is our big drive. We have over 70,000 doses to administer. We want to make sure that our high-risk populations, that is the elderly, the very young, those who have obesity, chronic diseases, pregnant ladies, we would like them to be vaccinated. This will help them, prevent them from getting influenza and from going on to possible complications, which we all know are very serious.
Right. Now, how is the influenza virus different from the common flu virus in terms of the symptoms?
Excellent question. Most people get a common cold. That results in a sneezing, snuffy nose, sore throat. You would not get a fever generally with the common cold. Now, with the flu, it's caused by a different virus. Viruses are the same, but and that one you get, in Trinidad we call it breakbone. You get pains all over, fever, and you might even get chills. So when it's very serious, it's the flu, and when it's very mild, it's the common cold. That's just as a layman how to tell the difference. But to prevent you from getting the flu, which is the bad one that can go into serious complications, we recommend you get the flu vaccine, especially for those high-risk groups that I mentioned, which are the elderly, very young, overweight, chronic disease, pregnant ladies, because you don't want, especially a pregnant lady, nobody wants anybody to pass away. But somebody who's in a reproductive age, the immune system may be a little weakened, and we recommend they all get the flu vaccine.
How is it? It sounds a little bit similar to dengue in terms of the symptoms. How can you tell whether it is or not?
Okay, right. So dengue, chikungunya, and Zika, they have similar presentations where you get this breakbone, you feel pains all over. With those diseases, you don't get the upper respiratory tract symptoms, which are sneezing, coughing, sore throat. Influenza, that is spread by droplets, airborne, so it comes into your nose and mouth first, and you get the symptoms there. Dengue, chikungunya, and Zika spread by mosquito. You get a bite on your skin, and it goes into your bloodstream, and you don't end up with those respiratory tract symptoms, such as the coughing, sneezing. So that's an easy way to tell the difference between, and you also could get a rash with dengue, chikungunya, and Zika, and with the common cold, you don't normally have that rash. You have that coughing and sneezing.
Okay.
But you get a breakbone.
Yeah. Now, the influenza virus, is it fatal?
Generally, no. I mean, if you get it, I get it, young adults, we will get it, we'll feel bad, for carnival, every carnival you hear about it, people say that the foreigners bring in these viruses and you get sick, but we recover. The challenge is that people who would not have strong immune systems may not recover as well, and really, now, let me just say one thing, there would be no reported confirmed deaths because of influenza last flu season, and so far for the season there haven't been any. But generally it can be serious, but there have been no reported deaths from the last flu season.
Okay, so if you did not get your flu shot or the influenza shot, for instance, the vaccine, and you were to contract that particular virus, what can you do to treat it? Well,
what we recommend is you go to your nearest health center or your physician, and they will give you the appropriate treatment. If they think it is very serious and it's escalating, they will then refer you to the appropriate place. But the thing is, some people stay home. It depends. If you're feeling very sick, you should go to the health center or your physician, and they will treat you appropriately. That's what we recommend. Of course, what Ministry of Health is, we recommend is that we don't want people to get sick to begin with, so we recommend you go and get your vaccine at your local health center. You could call your health center. It's available free of charge to the public.
So it's available at any health center?
Correct. All health centers in Trinidad and Tobago carry the influenza vaccine, so you should know where local health center is. You can call them. It will be in your phone book, or you could call the yellow 6411, and they will advise you of the number, and they'll tell you what day to come.
Would you advise individuals to perhaps, eat properly, eat certain types of foods that are high in vitamin C so that you can boost your immune system to even prevent this?
Well, generally we recommend a well-balanced diet at the Ministry of Health. As you know, that the biggest killer in Trinidad and Tobago is not murders, it's chronic non-communicable diseases. The papers might suggest otherwise, but the truth is we almost accept that we should die from heart attacks, strokes, and these sort of things. The truth is you don't have to. If you eat properly, a well-balanced diet, eat your fibers, vitamin C and so forth, cut down on some of the free sugars and our soft drinks and so forth. As you know, there's a legislation now to prevent selling of these sort of drinks in schools. So the idea would be eat healthy, exercise well, and that will help you to live a longer life, and you won't have to worry about contracting some of these non-communicable diseases that are very much preventable, just like the flu. But again, we have to change our lifestyle. So so your lifestyle changes, what you eat will help you with your common cold and the other things that affect a lot of Trinidadians and Tobagonians.
And how long do these symptoms for the influenza virus last?
They last a week or two. And again, it's normally self-limiting, and you recover.
Okay. What are your advice to persons who might be a little bit paranoid and wondering, they might just develop a little rash and they're wondering, oh my gosh, I have hand, foot and mouth disease, or what is your advice?
My advice would be to you go to your health center and let the doctor advise you as to what to do. They will just, the treatment would be, you treat the pain and maybe any sores or so that the person will have, make sure they're hydrated and that they're well. And they'll probably let you go home, stay home, and if you're an adult, they give you sick leave, and a child, they recommend they probably stay away from school to not infect with other people.
Are you aware of chickenpox or smallpox currently at schools, in kids at the moment?
No, there's no smallpox.
Is there any outbreak?
To the best of my knowledge, no. There's no smallpox, definitely, and chickenpox, no, there isn't any chickenpox outbreak, at least that we have detected so far.
Is there a season for chickenpox and smallpox?
No, smallpox has been eradicated, and chickenpox, well, it circulates, but there isn't a season really for that.
Okay.
The reason why there's a season for the flu is that the flu tends to spread in enclosed environments, and you find during the winter months in the northern hemisphere, everybody's inside, and so it's very easy to spread. While during the summer months, people get to go out. But now in Trinidad, we are fortunate that we are out all the time. We are blessed with beautiful weather, and but so the flu tends to happens from October to let's say April, when people are indoors a lot in North America, and well, they travel now, and so we get it done in Trinidad.
Okay. Now, in terms of different strains, because the former health minister mentioned that these things tend to mutilate a bit. So instead of you thinking, okay, well, I had this particular virus before, so I'm not going to get it, and then you get similar symptoms. How many strains are there of the influenza virus?
Right, that's a very good question, and that's why you need to get your flu shot every year. The virus is constantly mutating. You might have heard of H1N1, which caused a big panic a few years ago. Yeah. And right now there's also H3N2, which is also circulating. Now I don't want to get too technical, but there are main types of influenza. Influenza B, influenza A. Influenza A has H1N1 and H3N2, and those are the ones that could cause more serious illness. And so we recommend, now, as you said, the virus mutates all the time, and so every year what they try to do is make sure that whatever is circulating the previous year, they make sure that gets into the vaccine so that we are protected from that. Now, the truth is you can get the flu vaccine this year. If a new strain is out, you're not fully protected against that one. You may get sick, but you will not get as sick because you already have antibodies now. Mm-hmm. Now, it might not be exact to the one that you get infected with, but it will still protect you more than if you did not have it, than if you did not get vaccinated. So you're correct to say that the virus mutates, and therefore we recommend you get a seasonal flu shot every year.
And for children, at what age can they start getting these vaccines?
From 6 months and up.
Okay, 6 months, and that is fine. And they can get it on an annual basis as well?
Yes, everyone we recommend get your flu shot annually.
And what should parents of young children suspected of having contracted the disease, what should parents do? Should they keep them from school?
Of course, so both hand, foot and mouth disease and flu, we recommend good hygiene, washing hands. To prevent the spread, obviously we recommend you stay home and or stay away from work, and that will help prevent the spread to your co-workers or your classmates.
What are your closing comments? What would you like to tell the nation?
You brought it up that to eat well, exercise well, because I said it, when you go to the hospitals, we accept it in Trinidad and Tobago right now that you're supposed to get a heart attack and die, or you're going to die from one of these things. You don't have to do. These are very preventable illnesses, and you just have to eat well, exercise, live a moderate lifestyle, and you live a longer, healthier life.
All right. Well, we'd like to thank you so much for being part of our show this morning. Of course, we've been chatting with Dr. Harry Smith, Principal Medical Officer of the National Surveillance Unit, on several topics this morning. It wasn't just the influenza virus. We were talking about the different strains of the virus, as well as the hand, foot, and mouth disease, the common cold, chickenpox, and that sort of thing. And his advice to you this morning is to go and get your vaccines. It is available at any health center. It's readily available. You just need to walk in and they'll take care of you.